Medical devices are increasingly blurring that line between hardware and software.
A saying that I say pretty often is like slow is smooth and smooth is fast.
Take apart your device like conceptually into the core critical functions and then just build and test those. You're going to save so much money.
Yes, maybe we're building a physical product, but maybe our first MVP is just like a sketch of something that we put in front of a few doctors and say, hey, is this something you're interested in? What problems does this solve? What problems does this create? To just learn more about how those doctors might use it.
Showing your device to someone and getting their feedback is like so critical.
I want to take whatever it is I built and just like show the user how to use it. And the second they start doing something wrong, I want to be like, oh, no.
Yeah, that's really interesting. Dave, the prototype breaker.
Any sort of alarm system sounds great in an office environment. You're like, oh yeah, I can hear that alarm. But then you go into the OR or the ER and it's just loaded full of alarms. And like, well, yeah, they're never going to see or hear this audible alarm. We've got to give them something visual to focus.
I feel like that's one thing that we are kind of trying to do at Exo Medtech is like bring things that are happening in design and kind of SaaS-based companies, whether it's tools, principles, or practices, and kind of bring those into Medtech to operate. So I think that cross-pollination is really awesome. Hey everyone, welcome to the Medtech Innovation Podcast. I'm your host, Spencer Jones, founder at Exo Medtech, and boy, do we have an episode for you today. This probably is my favorite episode that I've recorded in like a really long time. I got to sit down with Jeremy Ridley. He's the Senior Director of Mechanical Engineering at Delve. Delve's a product development firm that blends kind of the digital and physical innovation in medtech, and they do some consumer package stuff, but like mostly medtech. He leads a 40-person team of engineers and designers tackling medical devices, wellness products, consumer products. He's got a biomedical engineering degree from Case Western. He's finishing his MBA. But like Jeremy is like such a great mind, kind of bringing the technical depth and the business mind into things as well. Really passionate about solving tough engineering challenges. But like we had such a thoughtful discussion around, design thinking, development, staging projects and the different arcs kind of along the way from proof of concept to alpha to beta. We talked about human factors, testing and evaluations, failure mode analysis, how many prototypes is too many, managing that iterative process, using AI to help accelerate that design and development process. I can't say how jam-packed the entire hour of this podcast is. And there was a really fun idea that we talk about at the very end of the episode that you do not want to miss. So yeah, I don't want to hold you guys back from the episode any longer. So without any further ado, let's get into the episode. Jeremy, welcome to the pod. Super excited to have you on today. Where do we find you? Where are you calling in from today?
Good to see you, Spencer. I am at my lovely apartment in Philadelphia. I'm up in like the Fishtown area outside of Center City, but working from home today and not in the office. So getting to relax a little bit more than usual.
So you're there, but you're a Bills fan, I see.
I am a Bills fan. I grew up in upstate New York, kind of between Rochester and Syracuse, like Finger Lakes area. And just haven't been able to shake the diehard Bills fan, even though I've been in Philadelphia area for now like 12, 13 years. So
yeah.
Still a little bit upstate.
It's a great time to be a Bills fan, honestly, too. Like, Josh Allen is the man.
It is a great time to be a Bills fan. You have to remember, though, there was plenty of time where it was not so great to be a Bills fan. And the joke in my family would be like, the Bills always play at 1. We got the crappy time slot, but no more with Josh Allen. So I'm just soaking it up while I can.
That's right, man. Like, the Monday night and Sunday night games are aplenty with the Bills.
They are. And it kind of really makes a hit on the bedtimes. I'm like, okay, Josh, can we just wrap this up and get ahead by 20 points so we can call it a day? But
for sure.
Yeah, it's been fun.
Yeah, especially being on the East Coast. Yeah. So you're a mechanical engineer, by trade. And I think you're, getting your MBA or almost done or just finished. But I feel like mechanical engineers, special place in my heart. Love working with them on a ton of projects. And I feel like of all the engineers, the double E's, the IEs, the you name it, I feel like they're the real builders and makers of things. I'd say biomedical engineers are kind of a second, close second. But on that engineering side, tell us kind of your role at Delve and the type of work that you guys do there.
Yeah, so I lead the mechanical engineering department. We have about 40 people in that department, spanning from engineers to kind of more product development type folks. So a little bit of a range there. I lead that department, and then Delve as a whole is a product development firm. We really tend to focus on medical device work, but we do a little bit of consumer products as well. I think what we like to say is that the consumer products kind of help cross-pollinate from industry to industry to keep the ideas fresh, and keep people learning, keep people growing. So it's kind of like 70 to 80% med device, med tech in that world. Yeah, and we do product development really from start to finish is the vision. So trying to like vertically integrate and bring together as many disciplines, as we can across that.
Yeah, that's awesome. That cross-pollination of ideas, like I'm going to steal that phrase because it really is critical and valuable. I mean, there's so much that happens. And I think like with you guys doing a lot of connected devices and kind of being in the IoT space, and, we'll get into the AI space later as well, but there's so much happening in the tech world that is completely foreign and also way more advanced than what happens in the medtech world. And I feel like that's one thing that we are kind of trying to do at Exo Medtech is like bring things that are happening in design and kind of SaaS-based companies, whether it's tools, principles, or practices, and kind of bring those into medtech to operate. So I think that cross-pollination is really awesome. But you've been there for a little bit over 10 years now, right? And that was an acquisition or something?
Yeah. So my 10-year anniversary was actually last week, and I tried to let it slide under the radar, but our HR team caught wind and put it in the big company announcement. So we're a product of an acquisition. When I started, we were a company called Bressler Group based in Philadelphia. We were like 30 people in the basement, and now we're 150 people. We have an office in San Francisco, Madison, Wisconsin, Philadelphia, obviously, and then Boston as well. So about 3 years ago now, two companies merged, Delve in Madison, Wisconsin, and Bressler Group to reform Delve. And then we also acquired a company up in Boston that does a lot of the kind of front end digital design work to add that kind of to our portfolio.
Yeah.
So we're really heavy, in the physical product space and wanted to get more into those like digital products to kind of, again, cross-pollinate just in a different format than what we were just talking about.
Yeah. No, that brings in, talent and capabilities, right, that you're adding there. And I think more and more things are being connected. Devices are getting connected in some way, shape, or form. So in terms of like skating where the puck is going, like totally see the logic behind the acquisitions and the mergers. But I'm just curious, 10 years is a long time these days, especially, right? Like my dad worked at the same place for 35 years. You never hear of anyone doing that these days. But tell me, is there something about kind of the culture or the clients or, what's made you stay so long?
Yeah, a little bit of that and a little bit of the company has grown and changed so much in so many cool and interesting and great ways that it yes, I've been here for 10 years, but it's totally different. I almost feel like it's been a new company kind of reinventing itself.
Yeah.
Every 3 or 4 years. So I've been there for a while, but it doesn't really feel like that to me. And then the products we work on are, I think, some of the most interesting in the world. So, it's both the fast moving techie products, but also these really complex, highly constrained medical devices that you've got to be thinking through every level. So I think it's one of the few places in the world that you get to experience the fast, interesting nature of those products along with the medical device stuff, which is kind of my passion.
That's really cool. So we're talking about, right, medical devices are increasingly blurring that line between hardware and software, right? And I know that this kind of hybrid space, like you said, is particularly interesting and compelling to you. In my view, just from some innovators that I've spoken with, I think a lot of them believe that as soon as you add, circuit boards and connectivity to a device, that it gets 10 times more complicated and 5 times more expensive to take it to market, right?
Sure.
So are they right? Or do you want to kind of demystify and dispel the notion that, device development that bridges that digital physical divide is not as risky or overly complex as they think?
I think with all myths, there's probably a kernel of truth there in that, yes, absolutely. If you go from something that's purely physical and you're starting to add a circuit board, you're starting to add a digital interface, yes, it's going to get more complex. But I think there are some good, straightforward principles that you can do to well scope your projects, well bound what you're working on to keep them moving along, kind of run down your risks quickly and not get too far along and realize you're not building the right product. And so I think if you follow those principles, you can get there in a really good way. And then I would add to that as well, yes, they might be a little bit more expensive to develop, but I think the ROI on them is much higher.
I agree. And there's, two things that kind of came to mind when you were saying that. I feel like once you have a digital element, and especially with an interface, right? A digital interface of some sort, feature creep is a lot easier where you can just keep adding and keep doing this. Oh, should we connect it to the, Pepsi machine, the vending machine outside? And so I can imagine that opens a door there. And then the second thing I was thinking is there's probably a lot of things where it's oh, well, now that it has a screen and it needs a power source, and then the power source has to withstand this, or it has to be rechargeable, or how do we dock it in it? But if you are a group like Delve and you're yeah, we do this all the time. right? Like we know, yeah, for this, you would dock it. For this, you'd have rechargeable batteries that detach. Like there's a playbook that you can run, right? Of, hey, we've done this before. This isn't as scary.
Yeah, exactly. If you're building it totally from scratch and you're trying to figure out all of those things you don't know, then yes, there's whole rat's nest of things that you've got to solve. But if you lay the right groundwork, a saying that I say pretty often is like slow is smooth and smooth is fast. When you want to go fast and you lay the right groundwork, look forward and say, cool, here are the potholes we're going to be encountering, and you can plan for those, you can make projects really smooth and seamless. And then you can really kind of watch out for that scope creep and embrace it when it's like the right thing to scope creep on, and then reject it when it's not the right thing to scope creep on.
Yeah, I know. I love that mentality of like having kind of a defined structure with kind of open to flexibility. You know what I mean? In a way where it's like, hey, this is what we're doing, but we're going to at least consider things that are outside of this like narrow scope, because like who knows, you know, when a good idea can come to the fore, right? It can be after you define this plan. And I think that's key, but kind of having the discipline to know like, hey, this is not worth it to add this, or this is for the Gen 2. That's something I see a lot of innovators struggle with, is they'll have the Gen 1 in their mind, and the Gen 1 is like, in all reality, should be the Gen 3. It's like, you don't need that bell and that whistle and this thing and that thing. And I saw this, it was a research report somewhere that talked about oftentimes like companies don't get acquired until their Gen 3 is on the market, right? I'm curious what your thoughts are on.
Well, first of all, you have to send me that report because I'm curious to read it. And that's totally true. There's going to be times when you want to create the perfect product, but that perfect product and that perfect vision is going to hold you back from the things you need to do to learn, grow, and get better in your business, in your device. And so you have to kind of protect that space a little bit. We have a lot of people who come to us and they say, I'm looking for an MVP. And we're like, awesome, great. That's what you should be looking for. But we got to talk about what you mean by MVP, because what they mean by MVP is this perfect thing that they've built up in their head that they think that there's a market for. And they may be correct that there is, but what we really want to coach them to do is take these really small chunk bites that they can learn along the way. Right. So yes, maybe we're building a physical product, but maybe our first MVP is just like a sketch of something that we put in front of a few doctors and say, hey, is this something you're interested in? What problems does this solve? What problems does this create? To just learn more about how those doctors might use it. And there's kind of a million variations on that.
Yeah, I almost think like, and maybe this term exists in some way, shape, or form, but like for medical devices, you almost need like other vernacular other than MVP, because it's like in SaaS, it's like the MVP is what you can sell because there's no regulatory body, right? So you've kind of got a show and tell MVP, and then you've got, let's take this into a cadaver lab, or, you know, maybe it's, if it's more digital, right? Like a non-significant risk little IRB study. And then you've got your MVP that you can actually take to the FDA and get cleared in like, you know, kind of Gen 1, right? And I think like, so like when someone says, I want an MVP, like, let's clarify what that actually means is like really important, because everyone kind of has their own like image of what an MVP is. You know what I mean?
100%. And, you know, as always, communication is probably the trickiest, most interesting part. So then even once we've talked about it, then it's like, great, now let's find ways to like show that to each other and express that visually so we can, you know, really make sure we're on the same page.
Yeah, I think the absolute paralyzing fear that a lot of medtech innovators have about showing anybody their stuff, right, is like doing such a detriment to them. And because it's like, you know, customer discovery is supposed to be focused on the problem, right? And I get that, but we'll dive deeper into human factors in a second. But like showing your device to someone and getting their feedback is like so critical. And if your requirement is, well, they have to meet all these things and then they sign a 50-page NDA before I'll even like, you know, discuss it with them at, you know, verbally, like you're never going to get the type of feedback that you need. I see that. I'm curious your thoughts like on the kind of the innovators that you guys work with. Like, do you see that hesitancy with them to like talk to people about it, like share what they're working on?
Yeah, I think you really need to approach it like in almost like a childlike manner. And you can say like, here's this thing, look at it, and just kind of let them go. I know I really struggle with, you know, when our team is doing consumer insights testing or HF testing or whatever it is, I want to, you know, take whatever it is I built and just like show the user how to use it. And the second they start doing something wrong, I want to be like, oh, no, here's how you do it. And I think, you know, that's a mentality that like serves me really well as an engineer, but not so much when I'm getting feedback from users. So I have to like really hold that back in myself and usually take myself into a different room and let somebody else show off the products, because we want users to look at this. We want them to break it. We want them to find the errors that we haven't found, because they're the only ones that can do that. We know how it works, you know, whether it's the surgeon who invented it or the engineer who helps do the CAD, like we know the ins and outs, we know the flaws, and we need to give them to users and practitioners to really highlight simplify those without us kind of dawing them for them.
Yeah, no, 100%. Before I jump into human factors, I want to ask, you guys have like 40 people in the mechanical engineering division, right? That you're leading. So thinking about, on the company side, so like, an innovator, small team, they've raised 3 million, 5 million, whatever, and they're like trying to move forward, sprint, design development, et cetera. So, if you were to build kind of a product development team from scratch today, like on the company side, right? And then they're going to work with a CDMO or a CM or a design and development group like Delve, like how would you recommend, kind of that like seed stage, team structure their team differently than most med tech companies do? Like, what are you seeing where people are getting it right, getting it wrong?
Like skill set structure?
It could be skill sets, roles. Like if you're like, oh man, this company came to us, they just raised their, pre or seed round and I love their team because X, you know what I mean?
I think the big thing is that you need at least one of those connector type people that can see the marketing and commercialization side, as well as someone who can kind of speak the language of engineers and bring those two worlds together. That could be the CEO, that could be the COO. I think I don't have a strong opinion on that, but somebody who can speak all those languages, and then, even better if they can speak the language of the clinicians as well. One of the areas we see teams fall down the most is when they can't have that good communication. Marketing found some really interesting data and they say, hey, there's a real market need for this. We found this, right? And then they shoot it over to engineering and engineering's like, nah, that's too hard. We don't want to do that. We'll do something similar, right? But that similar thing isn't solving the core need. And then it gets bounced back and forth between clinicians and the business side. And so I think those connector people are the secret sauce when I think of teams that are like really crushing it.
Yeah, no, that's a really good point. Kind of like the glue guy, right? On like a football team or baseball team, right? It's like they can talk to the engineers, but they understand, hey, this is going to impact our ability to bill for this code if we don't have this, you know what I'm saying? And like really understand like long-term implications on the commercial side. That's a really, really keen insight there. So getting into human factors, right? So I feel like everybody like, acknowledges human factors is important, but it oftentimes doesn't get kind of the adequate energy or resources from companies, or they try to just do it as like a regulatory check the box and they don't, think about it as like an integral part of the product development process. So, what's like a really consequential user insight that you guys have uncovered that like completely changed a product's direction? Kind of like, how did you fight for those changes or make those changes?
Yeah. So I think it's worth noting that I am by no means a human factors expert, but I am a huge fan of our human factors team and a lot of the human factors teams that I work with. You're really hitting it on the head is that a lot of companies treat it as a checkbox. Like I think it's great that the FDA requires formatives and summatives to be done, but it is important that those are the last of many steps, right? And those are the areas you want to be making small changes when you get into those. And in theory and summatives, you want to be making no changes come out of those. So it is about knowing that those are coming and starting kind of way earlier than that in a really iterative manner when it's low cost for you to iterate, easy for you to iterate, and you can have those kind of true MVPs. Now, I think as far as like specific situations go, they all kind of stem from that. Right? It's things where the engineers and the marketing team, or often there's like a really charismatic leader who knows his or her space really well and is really passionate and has been right like many times in the past, right? And they come and they say, oh, I know what the users want. And this new user that they're bringing in is a slightly different user than the past. And you can't, as any human being, you only have your perspective. You don't have the perspective of 20 other human beings. So those charismatic leaders say, no, I know what we need. I know what we need. And they say, we don't need to do this. And they move all that stuff to the very end. And you just end up wasting, a lot of time and energy onto when you get to your summative and, you don't pass your summative on the first try.
Yeah. And I think for the innovators that are listening out there, like that delineation between formative and summative human factors testing is like really key. And you need to be like considering and doing both. I think people think about, the market and surgeons and even like within a specific specialty of surgeon or user as like a monolithic group, and their experience is probably, if they created the device, that of their user, but they don't really appreciate that like it's definitionally anecdotal. People they're probably pitching it to know it's their idea and kind of the mom test, right? Like they don't want to tell them their baby's ugly. And there is so much, whether it's demographic, kind of geographic, ethnographic differences in users, even amongst the same taxonomy cohort, orthopedic surgeons or whatever. And, like OBGYNs, right? Like in the fertility space, there's, OB-GYNs that don't do any fertility. There's some that will only do screenings and do some of it. And then there's the REI specialist and they do all of it. And then there's REIs that do focus more on other things, right? And so I think like all of that is like super, super critical. I have a really quick story too, I want to say about the human factors testing.
Please do.
You know, you talked about going into the other room, like you don't want to coach them, teach them or whatever. We were doing human factors testing for Safe Break, and you know we had this wide group of nurses, you know what I mean, that we had kind of coached up and trained, you know, did the education part, and then later they come back, right? And we had one of them that the instruction was like scrub the hub, you know what I mean, which is like, you know, all nurses know you get an alcohol wipe, scrub the hub of the needleless connector. And she got out the alcohol pad and then like held the device like on the side and started like polishing the outside of like this full Safe Break device, like she was like, you know, shining it up with some oil or something, and we were just like watching her like, what is happening in there? And we were on the other side of like a one-way mirror. You know what I mean? So she was like right there, and we were just like, oh no. But it was like, it was so valuable because it's like, oh, maybe we should say like scrub the hub of the needleless connector with an alcohal pad and make that change to the IFU, right? Like, but it's just funny. You never like can appreciate how people will mess things up, or not even mess it up. Like identify weak points in your own education that you're like, I never would have thought they would have done that, but we got to be more clear on that. You know,
I had an old mentor who I used to be super nervous to show my prototypes to because he would break them all the time. And it took me a long time to realize, and many times of him telling me, like, that's his job. It's to break the prototypes and find the weak points that I had built in. You know, meanwhile, I was like trying to protect them and like, oh, I'll just show you how it works. Like, please don't touch it because you're going to break it.
Yeah, that's really funny. I was thinking like, you know, the term like world breaker, he's the prototype breaker.
Yeah. And now he still works with us. And now I send all the young engineers to him. And I'm like, okay, you got to send this to Dave and see if your prototype survives his test.
Yeah, that's really interesting. Dave, the prototype breaker.
Yeah.
So like last question here about like human factors. We'll keep it moving. So is there like a golden rule in your mind, or like a can't miss tactic that, you know, you always want to see companies follow when they're, you know, planning or executing human factor studies?
I mean, when it comes to human factors, of course, you've got to follow kind of like the FDA guidelines or do your formative and summative. So I just got to say that to cover those bases. But I think the best thing you can do is just go and shadow people in their existing workflow, and you will be amazed at the things you pick up that even if you bring them into your environment and have them use it and they can use your new device successfully, that you don't have any control over, right? Like, I mean, it's been an example that's used a bunch, but any sort of alarm system sounds great in an office environment. You're like, oh yeah, I can hear that alarm. But then you go into the OR or the ER and it's just loaded full of alarms. And like, well, yeah, they're never going to see or hear this audible alarm. We've got to give them something visual to focus attention on.
Yeah, it's a really good point. I have two things that I think like everybody should consider. You know, when you're doing recruitment for a human factor study, it's really easy to like narrow your audience out of like expediency to where, like, for instance, like if you're like, hey, I need nurses for my human factor study, you know, say you've got a hospital you've got a relationship with and they've got a massive med surge unit, right? And you're like, oh, I'm going to go get, you know, 15 nurses from this med surge unit. And it's like, no, go to the ER, go to med surge, go to like wherever your product might be used, try to get some from each unit, because like if you've ever worked in a hospital or worked with nurses, like they are very different animals. Like the ER nurses are one type of nurse, the OR nurses are another type, the med surge, like you name it, oncology. And so I like always recommend like try to get a wide berth amongst the end user cohort that you're evaluating. And then the second thing, and we actually got, you know, not dinged on this, but the FDA was like, hey, like I don't know if it was in a pre-sub but we had to redo it, like paying attention to the time lapse between education, right? So, and then execution, because with certain things, it may be fine to have a limited duration where you do the basic 5-minute teaching in servicing and then an hour later they do it. But we actually had to, I think it was like a full 24 hours that the FDA wanted us to wait. So like, I think it's inconvenient to a degree, but you have to factor that. Yeah, you have to factor that in. And then the whole thing has to be planned around that time frame, because it's like this day is this, and then you start the stuff, and because you don't want to have to redo it again for that specific purpose alone. You know what I mean?
For sure. I'm pretty sure, based on what you're saying, that our director of HF, Talia, came and told you what she needed to say, because she's always preaching the same. As I'm trying to like bring in timelines and like, look, the client wants it done faster. How can we get it done faster? And she's like, you got to do these things, Jeremy. You can't be changing these.
Oh, for sure. Yeah. But it's so fun. It's so, I love human factors testing. It really is fun. So iterating continuously can give you like really good speed to market, right? But when you're budgeting and planning for projects in a development timeline, you have to draw the line in the sand in terms of like what you're planning for, in terms of, right, we're going to do X number of versions. Like this is our goal. And we're going to make X number of versions, maybe take these to Y number of labs, right? Before before we believe that we want to hit design freeze. So like, how do you, and it may be vary for, project to project, but like, how do you recommend kind of budgeting and allotting time for that iterative development and kind of versions almost, but also still achieve, a good speed to market and like have a timeline and budget that clients are not going to, be outraged about?
Yeah. So I think a couple of tactics I like to use. The first one is, right, like we want to iterate often, but we also, I think, want to have kind of like arcs to our iteration. So we start by thinking about what those arcs are. The first arc tends to be what we call proof of concept. Second arc is what we tend to call alpha. And the third arc is kind of what we tend to call beta. Within each of those, we have tons of iterations, but that first arc, proof of concept, is really like proving out if the technology is there and if the technology is viable. So that's kind of our goal of that first phase. And then we're running 5, 6, 10 small quick iterations to get to that end goal. Second arc, what we call alpha, and there's a lot of names for it. People call this EV2. So a lot of different versions. I just like alpha and beta.
Yeah, I like it. Sounds good.
That second arc is about bringing all the disparate pieces together. Because in the POC phase, we might have 6 different features that we've tested out individually. Alpha is about thinking about the architecture and bringing them all together and kind of de-risking it from an architecture sense to make sure that they flow together. What new constraints have we found now that they're together? And then once we finish up with alpha, then we're on to beta, which is really about prepping for manufacturing and prepping for that manufacturing transfer.
Kind of DFM phase.
Yeah. Now, I think important caveat is that doesn't mean we're not thinking about DFM
sure.
back here at step 1. You've got to be thinking about it the whole way through. But often we're thinking about like, hey, we got a path forward here. And then it's kind of crossing the I's, dotting the T's on the back end. And I like to say that that is hopefully the most boring phase if we have really thought about all of the things we need to do. And in theory, at the end, we've done our testing and we're ready to kind of go to design freeze.
Yeah. And to use a phrase, it's almost like the DFM considerations are more formative in the early part and more summative in that like last part in that beta. I love those kind of 3 arcs that you define. I think it's really good. I mean, I will beat this drum all day around like take apart your device like conceptually into the core critical functions. Usually it's sub-assemblies, right? And test those and validate, okay, this part has to do this thing. It has to withstand this amount of torque, right? This gear, right? This part has to do this thing. And then just build and test those. You're going to save so much money doing that versus, all right, well, let's build this whole thing. Oh, well, it didn't attach well and the torque was off and the handle had friction on it. So we're not sure if like when you're trying to identify failure modes with like full ass prototypes of the whole thing, you really don't know why it failed sometimes because there's too many variables going on. So I'm just such a believer in that kind of like, you said 6 parts, right? Like building those, right? And then like bringing those into the second arc to like in, synchrony and seeing how they work together. I think it's huge. So on to the UI side. So front end UI development stuff here. How do you guys think about staging the UI development with kind of the hardware mechanical development? Like, is it in lockstep? Are there elements that are stepwise? Like what's you guys' like general approach?
When we think of more UI, digital products, software products, I think the data all says that those really want to be run in a more agile manner that are more sprint based. So what we do, and it relates exactly to those arcs, is we try to let those teams run in parallel next to each other, talking to each other, communicating, but we really have them sync up at the end of those arcs. So when we think about that alpha arc ending, we're pulling all that together, making sure that everything is in line so that our software teams can run and act in a much more agile manner than you can in digital products. Not that we're not trying to, but it's just harder and our sprints are different than the software team. So it's about kind of choosing our points when we're really going to mesh up really, really tightly and then having good forms of communication between the teams.
No, I totally agree. I mean, it's like once you've got, I would say almost like for the UI side, right? Like you've kind of got the brass tacks design constraints of here's the screen, here's the resolution, here's the size. That's kind of that proof of concept arc. And then it's like, okay, how are we bringing this all together? I think that like arced touch points, right, is like really, really nice because like trying to do it too commingled, I could see just like being a headache, right? And it really is 2 different skill sets too. So it's like there's kind of no need to push these teams together and shoehorn them into like one process. You know what I mean?
Exactly. And it lets us really kind of like turn our brains onto really specific types of problems at a different time. So we have, we try to give ourselves a bunch of engineers that can span the gap, but we typically have engineers, some love the back end details, right? And getting into the nitty gritty. So we can kind of staff them and build them around those later phases and bring in our more industrial design focused engineers on some of those front end phases to kind of get the best of both worlds. So those arcs kind of help us focus on that as well as keep the client in the right headspace.
Yeah. That's really good. So on manufacturing strategy, and I think I saw in one of your recent posts, like talking about nearshoring, right? Like obviously with the tariff stuff, which I do think is going to like in essence blow over in a large respect, but I don't think it's going to completely blow over or go back to kind of what it was before. But like, what are your thoughts on nearshoring? And when companies are thinking about building resilient supply chains, like what's your thesis on this?
Yeah, I mean, there's a lot of layers to it. I think the big one is, and it's no surprise, but it's to really focus on, the labor costs less so than the material side of things, and think about what things you can build into the design to cut down on labor costs and give more viability there, right? When we know we're going to be building something in a country with low labor costs, having a bunch of screws, it really isn't a big deal. But when you think about designing for something for automation, a snap fit is generally going to be a much better choice. And maybe it's more design time up front, maybe it's more process and like the validation side, maybe your IQ, OQ, PQs take longer, but in the end, it's going to pay off when we're thinking about the life cycle of product being 10 years. So it's about knowing where you need to go. And then even at the start of your POC phase, having a strategy of how you're going to get there. Great. We know this thing has to have a ton of snaps. Do those snaps together give us the sealing force that we need? Let's test that just with that one single variable first and prove that single variable works.
Yeah, no, that's really interesting. Yeah, you kind of hit on something there, right? Like the having design engineers and people on your development team that like have the foresight to be like, hey, like a screw would work here. And a lot of people could just go forward and you have a bunch of these screws, but having the foresight to be like, hey, I'm thinking formatively about DFM and not just like, will it DFM, but like how to make it DFM in a cost-effective way that can be later thrown into a fully automated assembly cell, right? That's really key. And I'll give a shout out to Jim Duncan. He's incredibly skilled mechanical engineer and designer that focuses on the orthopedic space. Used to work at Medtronic. We were going through some design and development stuff with like the combo spine product. It's, Dex 360. It's a spinal implant platform. But like, I just watched him do that all the time where it's like, well, here we actually want to use kind of a gnarled pin. And we want to do that because in sterile processing, there's going to be expansion. And if we put a regular pin in there, it's just going to fall out. Like small things like that along the way where it's like not a screw, not a pin, a knurled pin, right? Like those little things end up saving you a lot of time and kind of headache, right? In the long run.
Yeah. I mean, the med device space, I think more than any other industry, like you need that like foresight and almost like ability to see the future of like, okay, cool. When we get to our sterilization validation, here are the things we're going to have to be thinking about. Yes, the device will always be used in 72 degrees Fahrenheit, but when it goes into the sterilization validation, it's going to be seeing wildly different stuff. And there's, 1,000 different iterations. There's sterilization, there's manufacturing, there's the user side. So somebody and a team that can go out and like think forward to that place and then like backcast it to where we are and build from there.
Flush ports is another one. Cleanability with anything that's reusable is like so big. Yeah. And then another one too, and I dealt with this too at a previous company where like having things that are at rest on the shelf, like not time zero, like they're sitting under stress, under strain, pushed open, propped this way or whatever. And, then you have to, whenever you pull it off the shelf, whether that's 1 year, 2 year, you're relying on that thing to have a spring, a mechanical advantage or otherwise that like it's hard to really tell even with like accelerated aging how that component that's sitting at rest and is under stress or whatever is going to react, but like designing it in so it's not everything's is kind of time zero. I don't know if you've ever dealt with that in projects, but I feel like it's easy to do that where you're like, oh, we'll just have this propped open or this or that, and you see what I'm saying?
My first job out of school, I was working at a startup where we had some plastic parts under spring tension, and I thought I was like the kid out of school. I thought I knew everything. So I was like, I got the best design ever. It's great. Boom, 3D printed it, got some like prototype molds from Proto Labs and was feeling like really good. Put them in the accelerated aging, and like a day into our accelerated aging study, the springs overpowered the plastic and water shot everywhere. And then they all rusted and it was like this lovely little like egg on my face. But it's been a super helpful like learning experience.
Oh yeah.
And that's what it's all about, I guess.
Yeah, no, for sure. So, kind of talking about AI for a little bit, everybody's talking about AI, I think in product development on the software side, especially. And I don't know if, vibe coding, Cursor, Windsurf, Replit, all those things are awesome. I'm curious kind of how you guys are viewing the potential to leverage AI in medical device development on the hardware side, specifically at Delph.
Yeah, so I definitely can't talk much about the coding side. You want to keep me far away from that. It's for everyone's best interest. But on the mechanical engineering side, even though it may be a little bit less obvious, we're still using it to drive a lot of ideation, a lot of thought process. Essentially we're using them, as a kind of like critical part. So we'll be tossing out ideas, seeing what they say back to us, and And we've been really successful at using that to like create these little seeds that our engineers can say like, okay, cool, there's something here. Like the idea that came from AI, probably bad, but it sparks something and we can kind of grow that and like foster it into something that's real. So, our team is using it in a bunch of different forms pretty much every day to do those type of things. The other thing that I have found really useful, because even though I'm in the med device space, requirements and keeping track of those is just not how my brain works. I like, building the physical thing, but we have used it to help us guide a lot of our requirements writing and guide a lot of our requirements capturing, especially early on when we're outside of design controls and they're more of a organization tool than really being like a regulatory deliverable. They really kind of foster that growth pretty early on in a lightweight way for a team.
Yeah, no, those are really cool use cases. I'm bullish on it, on AI. Like if anyone's ever heard me open my mouth over the past 6 months, I'm just, go ahead.
I think you have to be, right? If you're not, you're falling behind.
Yeah, totally agree. Like I'm really bullish on it. And like, not even like everybody has to become an AI expert and every single facet of everything we do has to be infected by it, right? Like I think like there's so many small wins you can get. Like the other day I was having to, we're trying to heat stamp for this vac sponge product we're developing at Laborations. We've got this foam and it's a specific type of medical foam and we're going to heat stamp it, right, to the end of this tubing. And, we were having a discussion with the design engineers and they're like, yeah, like the type of tubing and the material we use for the tubing really matters here because like the melt temp can't be below a certain point, right? Kind of interacting with the heat stamp. And like went over to Perplexity and I was like, give me like the top, most viable medical tubing material options as well as the melting point for all of them, right? Like until I go compile that and do all of that like on my own would have taken, maybe it takes an hour, maybe it takes 30 minutes, but it certainly wouldn't have taken 35 seconds like it did there. And like you get these little like 30-minute gain here, hour gain here, 30-minute gain here. So like all of those process things. But, to your point, like, I've even described what I wanted it to look like. We had like a version of like this body component that was just like machine titanium, right? Mm-hmm. And then I gave it like a really, really like specific prompt and some reference images of some 3D printed, kind of lattice cancellous bone structure. And it was like, recreate this image, but make the body component made out of this 3D printed. And it was like brilliant. It looked so good. And it's like, then I can take that to a, 3D printing design engineering team and be like, hey, this is really what we're thinking. And it really just cuts down on kind of the knowledge transfer of like what's in your head. And for someone like me that can't do CAD and I'm not really a graphic designer by trade either, it like being able to like basically with words and reference images, like get that knowledge transfer out to the design team has been like really, really powerful.
100%. I think the value is really off the charts. And that's probably not a hard thing to say at this point, right? Like you said, you can find those little snippets of 30 minutes here, 30 minutes there. Our industrial design team is using it to create early renders really often. When you get to the back end, you still want to have a really, tight CAD model built in KeyShot, but early on, it's a great tool to say like, what could this look like? You put those things into VR and really try to like immerse yourself in the experience right away. Yeah, I think it's only going up from here when we start thinking about more agentic AI that has the power to go do things on its own. I think basically all of our engineers someday are going to become almost more like managers. So where they're managing a team of these agentic AIs and can send them out on missions.
God, yes.
To just like really,
really
drive.
I'm so with you. We've talked about that kind of at XO, having almost like a managed service type where it's like, hey, you have your regulatory agent and your quality agent and your, and like these different kind of agents. And not to say that like everything they do is going to be gospel, but like the idea is to like in a orchestrated and interconnected fashion, move the ball up the court on all of these things to where you're spending better use of your time when you're actually engaging with that human in the loop. You know what I mean?
Exactly. I can spend my time engaging deeply with clients, really understanding clients and get rid of as much of the busy work as possible.
Yeah. One other, and this is like a really easy from like an AI perspective use case. You were talking about user needs. I found value in, this is valuable for like problem discovery to a degree, but like I think when you're doing like traditional customer discovery interviews and you're focusing on the problem, but even when you start to kind of delve into like, hey, I'm going to show you this product, I want to get your thoughts, and I'm trying to like suss out user needs, right, and requirements, like do that call. And whether you use Otter or Shadow or one of these services, like take the transcript of that and then feed that into, a large language model and say like, hey, I need you to extract things that like could potentially be user needs or design inputs or like features that we may need to have, and like categorize those separately. And it will like give you a really good refined list, kind of helps you not miss stuff, right, from a call. And so you're not like furiously also taking notes while you're trying to like engage intellect. You know what I mean?
We do something really similar. We've shifted a lot from having someone like write our like user needs out, and we'll just have a meeting where we talk about all of them and we kind of like guide guide ourselves through it. And then our AI system just gathers up that transcript and then it compiles it for us, which has been really nice because everybody gets to be 100% engaged instead of kind of, oh, I gotta take notes here. And then the next thing you know, their email pops up and then like, oh, I've got to respond to that email. So it lets us really be like present and in the room, which is kind of funny to say about like a digital tool. We think about them always dividing us. And in some cases, we can use it to just like be present with the people that you're there with.
Oh, 100%. 100%. So talk about kind of failure mode analysis, here. So, I'm curious, like, if you guys have any kind of general approaches. I know this is probably something that's done. I mean, you do it design review meeting 1, 2, etc. But I'm curious if you guys have ever had UFMEA, DFMEA, all of that stuff. Do you guys accompany that with some like almost like destructive testing in a way beyond human factors? Or is there anything from like, going through the FEA process with multiple projects that you think would be insightful for early stage innovators like listening?
Yeah, I mean, something that we love to do is we'll create like a red team, we call it, which is a team of people who are loosely involved in the project, so know what's going on, but have almost like zero investment, right? So that they can come in, usually at the end of our arcs. We do it more than that, but those are the big ones, right? And we can say, hey, tear this apart. Tell us what we missed, right? And a lot of those things we can take and we say, great, that's a good point. That's Gen 2. And then a lot of those things are useful things that we'll want to build in. I think the biggest mistake that I see innovate, especially like fresh startup make, is that they think that the second like the CAD is finished and the design is done, they're like, great, we're going to release parts the next day. And you really need to like build in time to say, hey, everybody who's smart about this, tear this down and tell me what I missed and then make those changes, right? So you need to have like a week for those design reviews, those UFMEA reviews, whatever tool you're using. I think there's a ton of different ways to approach it to really tear that design apart, find those problems, and then implement them before you release your next version. And that is especially true in hardware because your lead times for parts are so much longer, right? When we're thinking about compiling code, you can compile code relatively quickly. It has its own frustrations there, but like I can't get machined titanium parts in 3 days in most of the world, right? There are times when I can, but most of the time we're talking about weeks, not days. So I need to find those things as early as I can.
Yeah, for sure. So kind of getting towards the end here, I'm curious if you take this question wherever you want. If you have any future predictions, if we're having this conversation in 5 years, you know what I mean? Like what aspect of like medical device development do you think will have changed the most? Like what aspect of kind of healthcare do you see, evolving over the next 5 years, or even something with Delve? Like where do you guys want to be? Like what's something where 5 years from now you think is going to be, significantly different, right, than it is today?
Yeah, this is probably more than 5 years out, but I am really bullish on and excited about the ability for artificial intelligence to create models to tell us how well a med device or a molecule or whatever it is, like how that interacts with the human body to really cut down on some of those lead times, right? So we can come up with a design, see how it's going to react with the human body, whether that's materials or physically, and know if there's something there right away. And then I think what that's going to lead much more towards is shorter development times, and then most importantly, more customized medicine and devices to get them to the patients that need them faster and have better outcomes from it.
That's really, really interesting. In my head, it's kind of like a AI-enabled mashup of human factors and finite element analysis, right? Where it's a virtual environment that, and the behavioral as well, right? Not just the physics of it, right? But the behavioral elements. That's really, really interesting and insightful. I mean, I saw, I forget who it was, but it was like a company, like Blender that creates like 3D animated environments. They're fantastic, right? The texturing, the this, the that. There was a company, and it may have been Google or a Google affiliated company, but like they had created this like almost like Blender style, but like physics focused environment where like water molecules would drop and disperse, and like you literally loading in from like an elemental, perspective, right? Like you put this material drill bit and then push it into this type of titanium and it would react the same way, right? And so I think there are some like precursors of that already.
And those are kind of the things that has inspired me. It's like, we can do that now.
Yeah.
Right? Like when you take it to the nth degree, then what does that model look like? And I think it's something more like what I described.
Yeah, that's really interesting. I mean, like the behavioral part of it too, it's kind of like almost like the mini worlds. Like, there's like, if you had an AI be like, okay, like depict 1,000 ways a nurse could interact with this device, right?
Yeah,
like it will be able to do that, to a high degree of certainty and create a bell curve. And then you can, push the bell curves. Like I could see like regulatory guidance in 10 years when this is a thing where it's like when you're using this human factors FEA software, you must pull in the bell curve parameters of like extreme behavior to this and go no farther than this. You see what I'm saying?
Yeah, absolutely. We invented it right here, Spencer, on the Exo Medtech podcast. The human factors FEA curve.
God, that's cool. Oh, that's a very, very interesting concept.
I think the physics is going to go a long way too. Like, yes, I think human interaction, but I think also it's like how the body interacts with it, how blood flows around it, how the materials interact. I mean, just at the rate we're seeing, these LLMs and other models exponentially improve, and the rate that the chipsets are exponentially improving, like you start holding all that thing together, I think it's going to be amazing what we see in the next 5 to 10 years.
Yeah, I mean, they're already doing this with drugs to a degree, drug discovery, right? And then, drug interactions and things like that. But I feel like another like super ripe for this would be biocompatibility, toxicology, because it's like, okay, known solvent, known duration of time, known, makeup and composited materials down to the gram, how much gram of Radel or, of PVC or TPE or whatever. And like, that seems like a very complex but solvable for AI math equation.
Extractables and
Exactly.
leachables,
Yes.
Your sterilization validation and off-gassing, all of those things. I'm really hopeful we're going to have really good tools to predict these, where now sometimes, and there's PhDs out there that are way smarter than I am that can do really good predictions on this, but I think that they're really going to take it to the next level on that stuff.
God, yeah, microbial ingress, like there's like so many opportunities there. And I think like net, you'd still have to actually do it because like, right, there's error in that, of
100%.
course. But like as a way to just like, hey, we're going to run this model and it's going to tell us like, oh, this was likely going to fail because of X, Y, or Z. And like to a degree, that's being done before you've even made parts. You know what I mean?
Right. It lets you, we talked earlier about like, okay, you need that person who can like predict the future and see what potholes we're going to run into. In my vision here, right? Like we're going to be able to come up with 100 concepts, and on, day 2 or 3, we start describing those concepts, what they look like, and we can get that like pothole information from these models, right? Like, hey, this is great. We love this concept, but you chose a material that's really going to have some biocompatibility issues 10 years down the road. So are you sure that you want to use this material? Can you find a different swap? Okay, great. Now let's swap it, but it creates this different problem in the model.
God, that's so interesting. I mean, in that respect too, like medical device hardware development, like could become agile, like software, right? Because the ability to kind of like, program this environment, deploy, evaluate, you know what I mean, is like as fast as coding at that point. So man, this was awesome. So God, we could keep talking about this for like hours. I'm just like, my brain is like buzzing after this last.
It happened to me last week. I was visiting some friends up in Boston, and one of those friends works for a robotics company, and one had just graduated MIT and was focusing on AI. And like 12:30, I was like, guys, I've got work in the morning. Like we can't talk about AI until 2 a.m.
Yeah.
And they're like, cool, we're going to stay up. And I was like, great. I'm going to bed because I've got a client meeting at 9 a.m.
Yeah, guys, it's a school night. I got to get to bed.
Exactly.
Well, dude, Jeremy, I'm so glad we did this. I mean, I think we connected like a year ago, and I'm like so glad, we're able to finally like, knock this out, and we got to catch up again soon because there was so many.
Let's not let it be a year this time around.
Please. Yeah. But so kind of final part here. Floor is yours to, plug whatever you want, give someone a shout out, like, whatever you want, put your LinkedIn, Delv's website, etc. We'll put all that in the show notes. So if somebody wants to get a hold of you or, talk to Delv, they've got kind of the information to get it. But yeah, floor is yours. Anything you want to plug, anything you want to promote.
Yeah. I mean, I think check out delv.com. It's got our contact information there. You can reach out directly to me on my LinkedIn, Jeremy Ridley on LinkedIn. So that should be pretty easy to find. Since we talked so much about human factors, I'd love to give a shout out to our human factors team who has basically taught me all of the stuff that we talked about. So yeah, I think that's the story. Reach out to us. We're super passionate about solving kind of the most complex, weirdest, challenging problems you got out there. So if you have a highly constrained, challenging, interesting problem, send it our way and let's see what we can cook up together.
Yeah, awesome. Well, Jeremy Ridley from Delv, thank you so much for being on the pod. For everybody, I don't know how you would turn this off. You were just like dropping knowledge bombs the whole time, but for everybody that stayed around for the whole pod, thank you so much. And have a great rest of your week.
Thank you.